So we knew she was going to be a girl, so, we were very excited about that. But we had no idea that she had a cleft palate.
My OBGYN said, did we know she was cleft palate, cleft lip? And I was like, what?
Hunter was born, and the cleft lip and palate were a surprise.
To me, I felt like this is so unfair,
When parents are expecting a baby, it's a dream, and they wish for nothing but the best for their child, and they are so excited. But what if the new baby comes with a congenital birth defect, like a cleft lip or cleft palate? All of a sudden, the game plan changes.
Can't express, how the hurt and the pain. I mean, we cried, it didn't take away from us loving her. She was our child, but it was a shock.
The cleft takes up all their space. Their whole awareness of the child is about the cleft. But within a few days, maybe even a few hours after baby's born, the cleft is just one more thing, like, they've got brown hair, or they don't have hair at all, or they weigh 8 pounds, or they weigh 10 pounds. It's just one more characteristic of the baby. It's not defining of the baby. The very first thing, whether it's a prenatal diagnosis or it's a surprise in the delivery room, we want that family to have contact with a craniofacial treatment team immediately.
What many families don't realize is they are dealing with one of the most common conditions diagnosed in newborns.
No parent, mother or father, wants pain for their child, and they see their new baby, and that's sometimes what they think about instead of the absolute joys of the first smile and the first steps.
Social worker Kim Urich is part of the craniofacial team at the University of North Carolina. She spent much of her career helping families who are coping with a facial difference diagnosis.
She made us feel, we're not alone. This is very common. There's other families, list of names of people we could talk to if we wanted to. Just really kind of embraced us and said there is a process for this.
Daughter Ivana was Leroy and Doris Arnold's 5th child.
This child, which was my only daughter, came out with this cleft palate I had never seen before. I was traumatized. It terrified me.
People's reactions tend to fall into broad categories. There's sometimes disbelief, denial, grief.
Well, I think it's okay to feel whatever you're feeling, and to say to yourself, if I'm upset or if I want to cry, that's okay.
Hey, families really need to be sad for a while. They really need to grieve for a while, and then they're ready to move into problem solving.
This is not a gloomy situation by any stretch of the imagination. It's certainly a treatable condition. It does require a fair bit of treatment from birth through complete maturation, but that's one of the nice things about having a craniofacial center.
After the initial appointment, the team will meet, discuss their findings, and create a comprehensive and coordinated treatment plan.
I think our initial challenge is to hover a little bit around that family, recognizing that some things may need to be said more than once.
Along with a surge of emotions comes a slew of questions.
You know this much about it, and instantaneously you want to go to the web and learn this much, which is kind of dangerous too, especially, with lack of sleep.
I lost lots of nights of sleep. I was horrified. What did I do? What did I do? What could we have done different?
That was the hardest part, though, not knowing what was going on, not knowing, what are we going to do to make her better.
The bottom line when a baby's born is the family's asking, What do I need to do differently? How do I meet this child's needs? How do I integrate this child into my family?
They wonder, why did this happen? Is it my fault? Especially moms always feel very guilty that this is something that they did that caused it.
This is just something that happens, and we can help you move forward.
It's important for people to know that this was not your fault.
As someone born with a cleft palate, Rachel Parker agrees.
Feeling guilty is probably one of the worst things that you can do, because my mom has told me that, she's never felt guilty because it's nothing that you can prevent.
So all the unknowns are really fear-producing, they're anxiety-producing, but just as soon as we can fill in some of the blanks and answer some of those questions, families calm down and they just do amazing things.
We always believe that knowledge is power, and usually the information that families get is very reassuring.
I love it when parents send us baby pictures, and it's so obvious that they're proud of their baby, and there's been no surgery and there's been nothing else, and they're just saying, look at my baby, this is a beautiful child.
We really encourage and hope that families eventually get to a place that they really can embrace what their child looks like and make photos and have those photos on the mantle.
And I've talked to those children as they grow up, and those pictures are part of their lives.
This is a lesson that started on day one for the Arnolds. They will always remember their delivery room nurse.
She began to minister the ideal that thanks for being a good parent, and it's going to be all right.
Start out right away by holding the baby, by talking about the baby by name, by giving the family a sense that this is a lovely child.
When you address that first, you put the birth defect second.
I'm William, and this is my mommy, Kelly, and this is my daddy, Bill, and I have a sister. Her name is Georgia.
For the Dukes and daughter Georgia, and the Potters and son Hunter, feeding was their foremost concern.
Feeding directly at the breast for a baby with a cleft palate is really not, it's just not possible.
It was the one thing that, I wanted to do more than anything in the world, and it was the one thing she couldn't do.
That is a huge loss right there and then. And for so many mothers in particular, that's a dream that is not easily given up.
We were lucky in that Hunter was able to use a special bottle, the pigeon bottle.
It was a huge relief, though, just knowing that, there was a special nipple out there that we could feed her with.
Feeding challenges are often compounded by the fact that surgery to repair the lip can only occur once the baby reaches a healthy weight.
Most treatment teams like to see at least 10 weeks and 10 pounds on the baby before they do a lip repair.
Thanks to the help and support of their team, both Georgia and Hunter packed on the pounds they needed.
And, our pediatrician at one point said, that's the hardest thing that a newborn has to learn anyway. And he's got to learn a different way. I guess the pro side of that is he didn't know any different.
Feeding is by far and away the most pressing thing on most families' mind. The second thing is this fixable?
We just wanted it to be corrected and let her go on and, lead a normal life.
So we couldn't wait for his lip to be repaired.
Most lip repair occurs on a healthy infant at 3 months. Palate repair usually occurs between 9 to 12 months, although it may occur earlier or later depending on the needs of the child.
Well, I've had parents talk about that moment as etched into their memory permanently. That first time seeing their baby after the first surgery.
Despite the fact that this isn't what you really expected or thought was going to happen, you're really going to miss the way your baby looks.
Everybody would love to think, oh, you have the first surgery, it's closed, it's done, we're done, let's get out of here now. But that's just not the reality.
That's what I heard you say. So we try to coordinate their care and coordinate their surgeries. So maybe they have a lifetime need for a few surgeries, but if we can do their tubes with their palate repair or their lip repair, that saves them a separate anesthetic. And the same with some of their dental needs.
The most common dental
difference with the cleft children is that often teeth don't erupt in the sequence that they would normally expect.
So the team's really going to be paying attention to that because that has long-term consequences for preparation for orthodontia.
We want to help them to develop self-confidence and have a pretty smile.
The entire treatment process is guided by the cleft palate team.
It's like this huge support group. You know, they know what you're going through because they've seen it, you know, thousands of times before.
The team approach takes all of the planning of the different phases for the child at different ages of the child and helps to coordinate so that we're not going down the wrong path.
Having people on the team who can be there as those issues arise and who know the child from before the issue got started is really powerful. It's really helpful.
We had the cleft lip, we had the cleft palate repair. Those are separate surgeries. And then we're moving forward. Now we're working with a speech pathologist.
You know what that is? It's a shovel. Good job. With kids with clefts, they don't really develop certain sounds because they don't have the ability to build up pressure in their mouth, because their mouth there's basically a hole in the roof of their mouth, so the pressure leaks out. So we're kind of making sure that all their other language skills are there and moving along as they should.
Social workers and psychologists are also an important part of the team.
Every family likes to think that their child isn't going to have psychological or personal distress. But the truth is, we all have problems growing up. And these children have some unique challenges that happen along the way relative to school or teasing.
Even if they didn't have a facial difference, mean kids find something to tease you about. I don't care what it is.
I mean, if you sit there and you worry about it all the time, then I think that does something to the child or patient. But if you just give them the opportunity to grow up normal, you know, they'll grow up normal.
Today there are well over 100 cleft lip and palate teams in the U.S. It is important to connect with a team you can trust.
I think it's reassuring as a dentist to see a child that has been part of the team from the very beginning and to make sure that all that care is coordinated. I think that's going to maximize not just the outcomes for the child, but the comfort for the family.
It is a group of professional men and women who take your child and center their lives around her.
They make that process work smoothly, and that's very comforting.
Having a core team certainly helped the Potters feel more comfortable with Hunter's treatment process.
There were many moments when contact with the craniofacial team really helped us stay calm and know that it can be a long road at times.
Flying near a high.
The team approach helped the Dukes as well.
You know, there were definitely some bumps in the road. I was on the phone with Kim a lot those first couple of months.
Everybody was on the same page. It's not like you're going to one doctor and he's saying one thing and another's saying another thing.
Whatever concerns you have, one of them won't be that she's not in good hands.
There were no stupid questions with the craniofacial team. I mean, I could ask some very humbling things and they didn't bat an eye.
Get ready. To know that you can pick up the phone, call the center, have somebody call you back if you've got a question or an issue. I mean, what a sense of security that provides.
It really turns out fine after all, and maybe better than you never thought, and your life may be much richer than you ever realized.
It's going to be okay. There were moments that I went through of saying, I would look over and I would go, God, we waited so long for a daughter.
I think looking back, if we'd have known where we would be today on day one, at least the stress and the gray hair factor would have been put at a minimum.
Some of these children grow up with, I would call them special gifts. I call them blessings in disguise. They have different kinds of understandings about human relations, the needs of others, that distinguish them from other people.
She's just a little dynamo. I mean, I think she's, she can handle anything. She can get through anything.
Thank God for the team. Thank God for professionals who care.
If I could say, well, if I had to do it all over again, would I rather have a perfect child? No, I'd rather have the child that I'm supposed to have.